So we'll look at another variant of Guillain-Barré syndrome. Yeah, it's a variant of Guillain-Barré syndrome. So this is what is known as what? The AIDP. Alright, most of the time we see it being written as AIDP. So this is acute inflammatory demyelinating polyneuropathy. Alright, so basically the myelin sheets are kind of like being eaten up, right? So that's a classic type of Guillain-Barré, so it's a variant of it. So that is the most common variant of Guillain-Barré syndrome. Alright, so Guillain-Barré syndrome is it's an autoimmune disorder. This is where your own immune system is attacking the myelin sheaths of nerves. Okay, so what actually happens in the acute inflammatory demyelinating polyneuropathy? So that the immune system targets strand cells of myelin, leading to segmental demyelination. This disrupts your nerve. Alright, so this will actually disrupt your nerve conduction, So nerve conduction is not going on as it should. So you have weakness, you have numbness, paralysis can also set in. So it typically begins in the legs, ascends upward, called ascending paralysis. So causes and triggers is what? Sometimes viral or bacterial infections. Right, so it can be triggered by recent vaccination, surgery, you have some other autoimmune disease, or sometimes COVID-19 and vaccines side effects can cause it. So symptoms is muscle weakness, usually in the legs, areflexia, paresthesia, then there's pain, then you have problems with breathing, that's respiratory difficulty. So diagnosis, you can just do nerve conduction studies, shows that there's slow conduction velocity. Lumbar puncture, you see that there's elevated proteins with normal cell count. That's what is known as albuminocytologic dissociation, right? So treatments use immunoglobulin, plasmapheresis, where you're trying to like filter out the bad autoimmune stuff that actually attacking the body. Then supportive care like respiratory support because the person has difficulties in breathing, pain management, physical therapy. So steroids generally not effective, but you can actually employ them. So prognosis is that 75 to 85% of patients recover fully or with minimal deficits. Recovery may take weeks to months. 5 to 10% may have significant residual weakness. So relapse is actually rare, but still possible. So that's it for this type of Guillain-Barré syndrome.